Good morning and welcome to the webinar this morning regarding MIOSHA's new emergency rules. I am Sarah Willey and I'm here today with my colleague, Sandy Andre, and we're going to be talking through the rules that were published yesterday by MIOSHA. When Sandy and I sat down to talk about how to best present this information to all of you, we decided really that there's three things that we need to be thinking about, and that is what's out, what do we no longer have to do, what's in, what do we still have to do, and what's next. What should be on everyone's checklist now that the rules have been revised. So that's the order of things today: what's out, what's in, and what's next. We have gotten quite a few questions, not surprisingly, which is fantastic. Most of those questions, I think we are going to do a great job of answering during our presentation. But we have also written the presentation to leave lots of extra time to answer questions. So as we go through this, we will be pausing and taking questions as they come in. So welcome and thank you for joining us. Let's just go ahead and get started, okay? So for those who haven't had a chance to look at the rules, haven't had them in hand, just a quick overview. So yesterday, MIOSHA issued revised COVID emergency rules. Those are effective immediately. Okay, so we can just go ahead and start following those rules now. They do completely supersede and replace the old emergency rules. Okay, so these new ones, the ones that are dated, they're actually dated May 21st, but they weren't issued until yesterday. Those are the ones that we should be relying upon for workplaces in Michigan to understand what COVID safety rules are required in Michigan. The rules say they're going to remain in effect until October 14th of this year, and we know that is because there's a 6-month limit, or a total of 12 months of how long MIOSHA can issue these emergency rules. Now, of course, they can be revised again before October 14th. There's, I've already gotten a handful of questions anticipating Governor Whitmer's rescission of the mask requirements for everyone as of July 1st, right? So Governor Whitmer has said that the Department of Health plans to revise its order to remove the mask requirement for everyone effective July 1st. And so we would anticipate that perhaps MIOSHA will do the same for workplaces effective July 1st, but that has not happened yet, nor has MIOSHA promised that, okay? So all we know right now is the rules that we have in front of us, and we'll explain what the mask requirements are for those rules. Those might get updated as of July 1st, those might not. And just a reminder, as we're talking through the specific MIOSHA COVID requirements, OSHA does also have a general duty clause, and of course that also remains in effect because that's always in place. So on top of this, all employers have a general duty to provide a workplace free from known hazards that are causing or likely to cause death or serious physical harm. And so as you're thinking about what measures are required to protect your employees from COVID, of course, we have all of these specific MIOSHA rules. But in addition to that, we need to be keeping in the back of our mind that we also have a general duty to make sure that we don't have a workplace in which COVID is likely to be spreading without us taking any sort of mitigation measures to stop that. Okay, so with that, let's start with what is out, okay? What things can I stop doing? Because they were in the old MIOSHA emergency rules and now they are not in the revised ones. And we're just gonna jump right in here, okay? What things can I stop doing? Number one, top of the list, right? I don't think this is a surprise to anyone. You can stop requiring people to work remotely because COVID says you have to, okay? The revised emergency rules make no mention whatsoever of a remote work requirement. Honestly, I had anticipated that MIOSHA would, even though would not require it, but maybe encourage it, and that did not happen. There is no mention of remote work whatsoever in the revised rules, okay? So you no longer have to prohibit in-person work. This next one, I think lots of people are going to be excited about. That COVID-19 safety coordinator that you have, you still need to have one, but there's no longer a requirement that that person has to be on site at all times when employees are present. That went away. We no longer have to have those posters encouraging employees to stay away from work when sick, cough, and those cough and sneeze etiquette posters and proper hand hygiene practices, etc. Now, of course, you can keep those posters up, and frankly, it's not a bad idea to do that. You don't have to go around your plant today taking all those posters down or your workplace, but those are not required under the MIOSHA rules. This next one is interesting, okay? The social distancing requirement now only applies to employees who are not fully vaccinated, okay? So we no longer need to ensure that fully vaccinated employees maintain a 6-foot distance from each other. And I know the question we're going to get on that, which is how in the world do we enforce that if we have some employees who are fully vaccinated and some employees who are not? And quite frankly, we're going to get into the weeds with that with regard to the mask requirements too, and how you know, or the options for enforcing those requirements with regard to which employees are fully vaccinated and which are not. There are, MIOSHA gave us a handful of options, compliance options in that regard. So we're going to talk more about that. Also, with regard to social distancing, we don't have to have those ground markings, signs, physical barriers, etc., to make sure social distancing happens. The only requirement is that we have to the extent feasible, make sure that employees who are not fully vaccinated have a 6-foot distance from each other. Now, of course, that's not always feasible, but if it is, MIOSHA wants employers to continue to enforce that for employees who are not vaccinated. Okay, what else do we not have to do? Well, there's a handful of things regarding cleaning and disinfection, and just a few things regarding that daily health surveillance. With regard to cleaning and disinfection, there are some basic cleaning that we have to do, but we no longer have to have that established attention for those high-touched surfaces or shared equipment, right? So we don't have to go through every day, 5 times a day, disinfecting those high-touch surfaces. And we no longer have to have a cleaning and disinfection procedure specifically related to employees, visitors, or customers who have a suspected or confirmed case of COVID. With regard to health screening, celebration here, no more temperature checks, guys. So temperature checks are no longer required. We do still have to do the daily questionnaire, but the temperature check requirement has been removed. And also, we no longer have to notify the public health department when we receive notice that an employee, a visitor, or customer has been diagnosed with COVID-19. And I think they removed that requirement because they realized the health department was already receiving that information when somebody tested positive usually from the lab, and that it was just a redundant notification. So we can take that off the list as well. Okay, what is no longer required with regard to masks? So number one, we don't have to provide them anymore to fully vaccinated employees. Number two, we don't have to require them for fully vaccinated employees unless it's a healthcare setting where patients may be present or they're using an airplane or public transportation, because that's required right now by CDC guidance. Okay, but otherwise, we no longer have to require masks for fully vaccinated employees. There are some changes, though, that apply to everyone. Okay, so in the old MIOSHA emergency rules, there was this requirement that employees had to wear masks in common spaces, regardless of whether they were within 6 feet of somebody else or not. And that has gone away. That automatic requirement of masks in common spaces is no longer present, okay? We no longer have to require masks for anyone if they're working outdoors, okay? So we've got plenty of industries that are doing outdoor work, especially now in the summertime. So vaccinated or not, employees do not have to wear masks while working outdoors. And we no longer have to require masks for any employee, vaccinated or not, who can consistently maintain 6 feet of separation from others in the workplace. So if you have an unvaccinated employee who's coming back and maybe doing office work in their own office, and they can easily maintain 6 feet of separation from everyone in the workplace, you do not have to require that unvaccinated employee to wear a mask. The only time you would have to require that unvaccinated employee to wear a mask is if they couldn't maintain 6 feet of distance from others. So perhaps at a meeting or something like that. Okay, what else do we not have to do? Okay, so we no longer need to include an exposure determination in our COVID-19 preparedness plan. There was an old requirement where you had to specifically detail that. So we no longer have to do that. And we no longer have to prohibit employees from using each other's phones, desks, offices. And that last one I already covered. And then our last slide on what you no longer have to do, and then we'll take some questions, is all of those industry-specific requirements that used to be in the MIOSHA emergency rules have gone away. So the old emergency rules had a section that applied to everybody with lots of requirements, and then there were industry-specific sections for healthcare, for retail, for offices, for manufacturing, et cetera, with their own requirements, okay? So all of those industry-specific second set of requirements have gone away. All workplaces now are subject to the same MIOSHA rules. Now, I will point out that we do have some Michigan Department of Health emergency orders that are specific to some industries, like healthcare, like childcare settings, et cetera. Those have not gone away. Okay, so if you are an employer who is subject to those Michigan Department of Health orders, you do still need to be following those. And then finally, for record keeping, we don't have to keep those daily health screening records for fully vaccinated employees anymore. Okay. Now, interestingly, and this was a bit of a head scratcher, the MIOSHA rules require employers to continue to do or require the health screenings for all employees, vaccinated or not. It's just that you don't have to keep them for fully vaccinated individuals. We have a call into Sean Egan, who's Deputy Director of MIOSHA, to ask for more information about that, to make sure that what's on the page is indeed what MIOSHA intended there. But for now, all employees have to do the health screening, but you don't have to keep it for fully vaccinated employees. And then finally, the old rules had a requirement that employers maintain records for 6 months from the time of, or I'm sorry, for 12 months from the time of generation. That has been cut in half. So employers now only have to keep those records for 6 months. Okay, so that's what's out, guys. That's the list of things that you can stop doing. Sandy, what questions can I answer now in that regard?
Yeah, thanks, Sarah. It looks like we have a number of questions just wanting to circle back on the daily entry health screening. So can you just remind the group of what remains to be required in that aspect and the piece that can stop?
Yes, exactly, right. So as I said, that daily health screening protocol does have to continue for all employees and contractors coming into the workplace. And the verbiage is almost exactly like the old rules. It has to be a questionnaire covering symptoms and suspected or confirmed exposure to people with COVID. Okay, so those questions that say, have you experienced the primary symptoms of COVID? And then listing out the symptoms, and then asking, have you tested positive for COVID in the last 10 days? And then asking, have you had close contact with somebody who's been confirmed to have COVID? That has to continue for everyone, but you don't have to keep those questionnaires for employees who have been fully vaccinated. And as I said, this is probably the biggest head scratcher for us with regard to the revised emergency rules. Do you feel like that answered the questions that were coming in, Sandy?
Yes, that was perfect. It was just, it looks like just a clarification on if the health screen needs to still happen with everybody, and a reminder that the temperature screen piece can come out of there too. Just wanting to slice and dice that a little bit. Yep, you got it.
That's exactly right. And when we say the temperature screen, we mean actually taking their temperature. So you do not have to take the temperature of any employee or contractor coming into your workplace now. Having a fever is a COVID symptom, so your questionnaire might be asking them, do you have a fever? And that's fine, but you do not have to take their temperature.
Perfect. And another question still related to health screenings and the record keeping requirement. So now that the record keeping requirement is 6 months for unvaccinated folks, do clients, employers still need to keep the old ones that they've now had on file for maybe about a year or so? What should they do with those?
I think we should have a big bonfire party, don't you, Sandy? You only have to keep them going back 6 months effective today. So you can purge your old health screening records that are older than 6 months from today. So that would be what, November or so? Do I have my math right? So anything older than November 25th, guys, you can begin to purge those and get rid of them. I am racking my brain for a reason as to why you would want to keep those, and I can't come up with one. Those daily screenings that are more than 6 months old, I just can't imagine that you would need them going forward, and MIOSHA does not require you to keep them.
And it looks like the bulk of the other questions are something that we're going to get to in just a little bit. And it's just generally recommendations for how we navigate this vaccinated, unvaccinated space in the workplace. So the questions that are in the queue, we'll get to them. We promise. Right. We promise. Okay. We'll address that.
I see one that says, are there updated printable posters available? And MIOSHA has not published printable posters yet to reflect any of these changes. So I'll just go ahead and answer that one too. Okay, Sandy, you're going to talk about what's in. What do employers still have to do? So take it away.
You got it. Thanks, Sarah. Okay. So if we can just flip to the next slide. Perfect. So Sarah got to give you all the good news, right? Of here's the things you guys get to stop doing. And then here I come saying, oh, but don't forget that we still need to remember to do these things. So, but I see a couple of questions in the queue related to a handful of these items. So hopefully this clarifies things a little bit. So your COVID preparedness plan, that still remains a requirement, right? Sarah talked about in the previous slide about the exposure determination used to have to be included in that preparedness plan. That piece is no longer required, but employers need to continue to have their preparedness plan, make it accessible to their employees, all of those pieces. And to the extent that now that you can stop doing a handful of things and you are going to stop doing a handful of things, you are likely going to need to update your preparedness plan to make sure that it's reflective of the safety practices that you have in your workplace. So still a requirement, and you'll want to, of course, make sure that it's an accurate reflection of what's going on in your organization at your facilities. Basic infection prevention requirements. We still need to be promoting frequent and thorough hand washing and providing hand sanitizer to employees. That is a requirement that did not go away. We still need to prohibit entry into our facilities for symptomatic employees, employees who have tested positive, and non-vaccinated close contacts. So some of this kind of ties right into the daily health screening, right? Sometimes that's that piece and how folks are answering that piece tells us if they can be in or out, and we meet our obligations to make sure that we're not letting folks into the workplace who maybe should be going into isolation or who should be in quarantine. Now, it's important to remember, right? It's here, it says non-vaccinated close contacts. Of course, you may remember several weeks ago, sometime in April, I think, the CDC updated their quarantine requirements, talking about that fully vaccinated individuals who are identified as close contacts, as long as those fully vaccinated individuals are asymptomatic, they do not need to go into close contact quarantine. And so, but of course, non-vaccinated folks still do need to do that. Still need to continue to do increased facility cleaning in accordance with the CDC and using EPA approved disinfectants. The piece, of course, that had changed there is some of the cleaning specifically regarding high touch areas and those types of requirements, but the types of cleaners we should be using and the stepped up cleaning that we should be doing, that piece remains. Great, next slide, please. And as we've talked about a couple times, with respect to health surveillance, okay? So we do still need to be doing daily health screening for all employees and contractors. There were a couple of questions in the queue. What about visitors? So remember, under the MIOSHA rules, there hasn't been a requirement for a while to have your visitors do the daily entry health screening questions. That is generally lived in other requirements, for example, MDHHS orders. And for those of you who are on the call this morning who may be in other industries like healthcare, long-term care, where you have MDHHS epidemic orders that apply specifically to you, some of you do still have requirements for visitor entry screening, Michigan Department of Corrections type of locations, all of those pieces. So we're wanted to just make sure that we understand what's changing in the MIOSHA rules, but also understand our obligations under any MDHHS order. Okay, we do still need to require our employees to promptly report signs and symptoms. So that's mainly during the workday, right? So if I come in the office this morning and I complete my daily entry screening and, no symptoms, no contacts, all of those pieces. But as I'm at my workstation today, I start to experience symptoms. We still want to make sure that our employees understand exactly what they need to do in that situation, who they need to report it to, where they need to go, all of those pieces. And so this next requirement for employers to ensure that they are isolating and sending home employees who do begin to experience symptoms or who are reporting symptoms or have tested positive, or require remote work for those individuals, right? Again, the prohibition on keeping symptomatic and suspected cases of COVID out of the workplace is still a requirement. So all of the processes that we've built over the last 12 plus months to be able to do that remain in effect and remain important for us to keep in our workplace. We still have the requirement that we notify coworkers, contractors, and suppliers if we have a positive case in our workplace. So if you have an employee who's reported positive, we still have our obligations to notify any coworkers who may have come in contact with that person with a known case of COVID. So Sarah talked a little bit ago, we kind of call it our positive test protocol, that a piece came out of that. We're no longer required to contact the health department, but we still have to do kind of that internal facing type of notification for any individual who may have come in contact with that positive case. And again, prohibiting employees from entry until any isolation or quarantine requirements are fulfilled. Remember, here in Michigan, we have the Michigan COVID-19 Employee Rights Act. That employers have an obligation to keep COVID positive, symptomatic, and close contacts out of the workplace for certain periods of time. And those generally, right, follow the current CDC guidelines. So I'm speaking really broadly here, but that's generally, right, if I'm positive or symptomatic, it's 10 days after my positive test or symptom onset, whichever is later, plus fever-free for 24 hours, plus my symptoms are improving. So at least that time frame for symptomatic or positive COVID cases and close contacts, it's generally, it can be, right, the 14 days or whatever the local is directing. And we know here in West Michigan, a number of our locals have adopted a 10-day close contact quarantine type of period, but remember that also applies only to non-vaccinated individuals. So we still have all of those requirements under the COVID-19 Employee Rights Act, and those are just parallel requirements in the MIOSHA rule. So that's always nice when they say the same thing and they're not conflicting. So good news there. Next slide, please. Okay, so now let's talk about safety coordinator, social distancing, and masks. As Sarah mentioned, we do still need to have our safety coordinator, but that person is no longer required to be on site anytime employees are there. So remember, your safety coordinator is going to be somebody who is informed about the safety practices at your workplace and can take and answer questions related to those practices, has a good understanding of your preparedness and response plan, all of those pieces, but they no longer need to be on site anytime employees are there. So that is good news. In terms of social distancing and masks, Sarah touched on this a little bit, but let's just circle back. Employers do still have an obligation to require social distancing for unvaccinated employees so that they remain 6 feet apart to the maximum extent feasible. So in your workplace, you do still need to have those types of protocols and apply them to unvaccinated individuals. Similarly, as we look at masks, our obligations as an employer have changed a little bit and have this unvaccinated, vaccinated kind of dynamic, okay? So employers are still required to provide non-medical grade face coverings, right? But they need to provide them only to the unvaccinated employees. And in terms of where and when I am wearing my mask, an employer needs to make sure that unvaccinated employees wear their masks while indoors if they cannot consistently maintain 6 feet of separation for other individuals. There was a couple of questions in the queue related to, well, what about shared spaces? Remember, there used to be the requirement about within 6 feet and then any time in a shared space. Well, the shared space requirement came out of the rules, okay? Right, it used to be all the time when you can't maintain social distance and all the time when you're in a shared space. So the shared space piece came out. So we're just looking at any time an unvaccinated individual cannot maintain 6 feet of separation indoors. That's the masking requirement as we sit here today. Unless, right, if you're an employee in a healthcare setting where patients might be present, or right, we're in kind of the public transportation industry, right? So, or I'm using an airplane or public transportation in connection with my job. Those requirements remain more strict. Next slide, please. So now let's talk about, continue talking about masks and a little bit about training, okay? So masks, compliance options. This is the big question that we have in the queue. Sandy and Sarah, how in the heck am I going to monitor who's vaccinated and unvaccinated so that some of my workforce can be non-masked and some of them aren't? So MIOSHA is laid out a couple of options for us that an employer can meet their obligation to make that determination, right? That these people are vaccinated and these people are not. And so it's okay for me to allow this group of people to do these things and require this group of people to do these other things. So an employer can make that determination in a handful of ways. First, it can keep records of whether employees are fully vaccinated. Okay, so you can ask an employee to show you their vaccine card. You can, require an employee to show you their vaccine card. All of those pieces, you can keep records of that status. Another option, and these are independent options, right? It's not all 4 of these on the list. It's any of these as options. You can post signs in your workplace that remind employees that are not fully vaccinated that they must continue to wear face coverings and maintain social distance while indoors. You can continue to allow or require remote work, right, for individuals in terms of vaccinated versus unvaccinated status. If you've got unvaccinated folks, you can continue to have those individuals work remotely, and you can or allow vaccinated folks who may not want to return to the office. If we're going to relax masking and social distancing, allowing those folks to continue remote work. That option lies with you as the employer to make that determination. And of course, You can continue to require face coverings and social distance for everybody, regardless of vaccination status. So as I look at these handful of options, it reminds me a lot, right, of the MDHHS order that was released a couple weeks ago that required establishments kind of to do a good faith inquiry. And here's a couple options on how you do that good faith inquiry to try to figure out if the person who's walking into your store unmasked is vaccinated or unvaccinated. And if you did one of these options of things, you're going to be in compliance. And so this list of 4 options reminds me of a bit of that. So these are the options available to the employer. As we look at training.
Sandy, can we pause there and answer a $1 million question?
Yes.
that
yes,
I know many folks have, so we don't make them wait any longer. So if we have employers who are interested in going with option 1, they want to keep records of whether or not employees are fully vaccinated. Can we ask employees to show us their vaccine card or make a copy of it or take a picture of it and email it to us? Can we require them to do that?
Yeah, you absolutely can. So for the employers, right, that's kind of the lens we're looking through. The EEOC has said asking an employee about their vaccination status or requiring or asking them to show you proof of that status is not a prohibited medical inquiry under the ADA, the Americans with Disabilities Act, right? That's what the EEOC has said specifically about COVID-19 vaccination status, okay? So we are allowed to ask that question. We are allowed to ask for proof. We are allowed to have a document that shows us proof in our possession. Where our obligation continues, right, if we have a document that talks about, Sandy Andre's vaccination status, right, we have an obligation to retain that in a confidential medical file because it is still medical information about me. And then under the MIOSHA rules, then we're required to keep that document for at least 6 months under the record keeping requirement. So yes, we can ask. Yes, we can ask for proof. Yes, we can get proof. But once we have that proof and we do those things, we have some obligations to keep it confidential and to keep it for at least 6 months.
Okay, so, and that's fantastic. So to say we had, dozens of people asking, can I require employees to show me proof of vaccination? And so you clearly answered that. The answer to that question is yes. There's information floating around out in the social media world saying somehow that's a HIPAA violation. It is not. Employers generally, unless an employer is also a healthcare provider treating their own employee, HIPAA has nothing to do with it, okay? It's the ADA that requires employers to keep employees' medical information confidential and limits when we can ask questions regarding our employees' health. That's the Americans with Disabilities Act. And the EEOC has been very, very clear that it is permissible to ask for an employee's vaccination status. So the answer to that question is yes. Now, the next question, Sandy, from a logistical standpoint is, okay, but I have a huge manufacturing facility. The HR department now knows who's been vaccinated and who hasn't. We've gotten confirmation of that. Can I tell the supervisors on the floor, can I give them a list of who's not been vaccinated or who has been vaccinated so that the supervisors on the floor have an understanding of who's supposed to be wearing a mask and maintaining 6 feet distance from others and for whom we don't have to enforce those rules? What do you think about that?
Yeah, I mean, I think we've got to have some communication to the people who are in charge of enforcing the safety rules of who's allowed to do what, right? So whatever the process is going to be at your workplace, I think it makes a lot of sense to be doing communication on here's the group, right? Here's the list of names on Tuesday of people who are permitted to be in the space without a mask. Right? That in some ways that doesn't give that supervisor any information about somebody's vaccination status. Maybe I'm splitting hairs here. But rather that person, here's a list of people who have gone through whatever our organizational process is, either if we've requested proof and they've followed through on that, they've done all of the things we've asked to be able to know that they can be unmasked in the workplace. So I think there's a little bit of process to that, but you do need to put information in the hands of the people who are in charge of monitoring your safety protocols, right? Between our group here had a conversation. It's no different than, right, if you've got an employee or a supervisor on the floor who needs to address people when they are not wearing their hearing protection, or they're not wearing whatever PPE, whatever your workplace safety rules are, and they see it, they've got to be able to act on it. And the only way to be able to do that is to know who has been approved to have a relaxed type of status.
Right. So, and again, the ADA would allow an employer to provide even confidential medical information. And I agree, Sandy, I think it's a stretch to assume that a list of employees who have been exempted from the mask requirement is necessarily medical information. But even if it were, yep, the ADA does allow employers to share that information to others in management who need who have a legitimate need to have access to that information. Yes. So it would be perfectly appropriate to share that information with those who need to have access to it. I wouldn't post names, yep, on your wall, right? I wouldn't say, here's a list of all the employees who have to wear a mask and here's a list of employees who don't. And I wouldn't do that for a whole host of reasons. But providing floor supervisors with a list either of employees who have been exempted from the mask requirement or the opposite. You could provide them a list of employees who have not been exempted, in other words, employees who are still required to wear a mask. That would be fine too. What the EEOC really says is vaccination status is not confidential medical information because people have all sorts of reasons not to get vaccinated or to get vaccinated, and it's not necessarily neatly tied to a health issue, right? And so that sharing that information is okay. And allowing your supervisors to follow up on then what would be a safety violation is okay as well. If you're going to share lists like that, I think the supervisors need to understand that there's lots of emotions and feelings that come with that, and that they should be mindful in walking around with the list or showing it to other employees, et cetera, because I think that's going to raise issues in many workplaces if they do that. Okay, I am sorry to interrupt. So carry on. Talk about training, Sandy. What is that still required, and do people need to update their training?
Yes and yes. So training remains a requirement in the emergency rules, and it needs to continue to cover workplace infection control practices, the proper use of PPE, in your workplace, steps an employee needs to take to notify you if they are symptomatic or have a suspected or confirmed diagnosis of COVID, and then a pathway for how they report unsafe working conditions in your facility, right? And that's maybe where your COVID-19 safety coordinator comes into play. So those training requirements are still the same. Those aren't new. One new piece, however, is that your training needs to include information on the vaccinations or the vaccines that are available for COVID-19. And to the extent that your workplace partners with somebody to offer those, or whatever your internal process is, it makes sense for that to be in the training too. So just want to pause and regroup here to say, hey, Sandy and Sarah, I've been operating in person, since the very beginning, and we did training way back when. What do I need to do? So to the extent, of course, that you're ever making any changes in your safety protocols, you always need to be doing some communication to your employee group about those, right? So this is kind of a twofold question. So as we're talking today and you see the list of things you no longer need to do, and you're going to stop doing some of the things you're allowed to stop doing, that's changing your safety protocols, and you need to be communicating that out to your employee base. So however you do that, right, and maybe you want an acknowledgement form, all of those pieces, however you do that, fold that into kind of these training requirements. But making sure that everybody who's on the call today, to the extent that you haven't yet included information about vaccinations available for COVID in your employee training, that's a new piece. And you need to circle back to your employee population and provide them that information. So that is a new piece. Okay?
Right. Yeah. And Sandy, let me just, I think the second option for compliance with the mask requirement, people are a little surprised to hear that you can just post a sign to comply, right, with enforcing the mask requirement. So I'm just going to reiterate that is an option alone. You do not have to collect or keep records of whether employees are fully vaccinated. A different option is to just post signs. The signs have to remind everybody that if they are not fully vaccinated, they need to both wear face coverings and maintain appropriate distancing. So that is a second option. Employers are really thinking about their culture, what they're trying to accomplish, maybe other concerns about particular spread of COVID in their workplace, et cetera, in deciding which of those two things make the most sense for them. And I've talked to many organizations who are opting to collect and keep the records, and many who are opting to post the signs. The only thing I will add is that don't forget, you do also have the general duty clause, okay? So posting the signs is enough at the front end to comply under the MIOSHA emergency rules. However, if we know, or if we have information that a huge percentage, right, or even some of our employees are in violation of a safety rule, i.e. the mask requirement, we know, right, many of our employees are not vaccinated, and now all of a sudden nobody's wearing a mask at work. You probably are going to have to address that problem under the OSHA general duty clause. Likewise, if you receive a complaint, Sarah she's walking around without a mask on, and I know she's not fully vaccinated. She's told me she's never going to get vaccinated. You need to address that like you would any other safety concern, just like you would if somebody came into HR and said Sarah's not wearing her steel toe boots, or Sarah's refusing to wear her hearing protection or safety glasses, et cetera. You're going to have to follow up on that, okay? So if you post the signs, but then you have information that people are violating the mask requirement, there is you really are going to have to take some amount of steps to enforce the mask requirement. Okay, I've probably made it worse and confused folks more, but nonetheless, tell us about record keeping, Sandy.
Sure. So the big change here, as Sarah mentioned, we're still responsible to maintain some records, but our change, it goes down to 6 months rather than 12 months for the pieces that we need. And we still need to maintain records related to training, right? So ding, 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 if you go back and circle back and do training about the vaccines available for COVID to your staff, right? That's a new training record. So hang on to that for 6 months. Still have to maintain records of health screening protocols for non-vaccinated employees. And again, we're trying to get some clarification on that. But for now, that's the requirement. Just the non-vaccinated folks on those daily entry health screening protocols for employees and contractors. We do still need to maintain records of what we kind of call our positive test protocol notifications, right? And so that's the notification that we do to our workforce saying, hey, workforce, you may have come in contact with a COVID positive individual, and if you've been identified as a close contact, you know, all of these pieces. But remember, we no longer need to keep a notification of our contact with the local public health department in a positive case, because we're no longer required to contact the local public health department. So that's a piece there. And then vaccine information. So Sarah just talked a lot about, right, the kind of the mask, unmasked, social distance, not social distancing for vaccinated versus unvaccinated individuals. And the options, right, that list of 4 options that an employer can implement to kind of make that determination. So to the extent that you're requesting a record in some way, you now have an obligation to keep that record for 6 months. That gets folded into this record keeping requirement piece too. Okay, next slide. Okay, now let's go ahead and talk about, so here's the $1 million list, right? Okay, so I'm listening to this webinar and I need to know, I have a good understanding of what's come out, I have a good understanding of what's remaining, but what are the things when I get off the call that I need to fold into my work day, right? All the HR professionals on the phone were just anxious for something else to add to their list, but here are the things that we recommend. The first piece is to review and revise your COVID-19 preparedness plan. To the extent, again, remember that you are going to stop doing any of the things that you're now allowed to stop doing, you're going to want to pull those out of your COVID-19 preparedness plan because you want that plan to be an accurate reflection of the protocols that you have in place. So for example, if you are an individual who put the remote work requirement in that preparedness plan, but we're no longer going to prohibit folks from working in person, we've got to pull that out, right? So that's a piece that we need to review and revise. And for those who are subscribers to the Resource Center, we are updating our template preparedness plan for you right now, and we hope to have that up today for you. So I saw a couple questions in the queue on that and just wanted to flag that for you as well. Okay. The next piece, right, we need to take a look at our safety training, right? So to the extent that, you know, you're not having anybody, or to the extent that you've got folks who are coming back to the office for the very first time since these rules existed, you've got a whole responsibility to offer them all the training we talked about, right? We need the workplace infection prevention protocols. We need to tell them how to report unsafe working conditions. We need to tell them what PPE is appropriate for their role. We need to tell them how and where to report symptoms and positive test, all of those pieces. But we also now need to tell everybody the options available for COVID-19 vaccination. So minimally, we need to be updating our training regarding that small updated change. But again, remember that as you're entering folks back who haven't been there for the very first time, the entire kind of training protocol applies to them. And then the big piece, right, that we've kind of been talking about here and there all morning is your organization needs to determine what your mask compliance strategy is going to be, right? You want to decide, are we going to have a differentiation between vaccinated or unvaccinated, or are we still going to just stay in the space that we're going to require everybody to do it, right? You need to make that determination. And based on those organizational decisions, you need to come up with an employee communication plan so that your employees know what your expectations are and what the rules are. If the last couple weeks have shown us anything, is that there can be a lot of confusion when there's not clarity, especially now that there is a pathway to allow different things for vaccinated and unvaccinated individuals. So you need to remind them of what your organizational policies continue to be, regardless of, right, what MDHHS or MIOSHA will now allow. You, whatever your policies are, is what you need to be communicating to them. And then, of course, if you are following the poster option, you need to prepare that. As Sarah mentioned, there's nothing yet up on the MIOSHA Office of Workplace Safety website for sample posters, but we'll keep checking back and we'll be sure to flag it if we see that change. The next piece is you need to prepare communications to employees regarding all of the changes in protocols, right? So all the changes you make to your preparedness plan, all of the pieces you're making to training, whatever you're doing on your mask compliance strategy, it's important to communicate all of those things back to your employees because it's important for them to understand, to have the information, to know what to do, right? I just want to follow the rules, employer, but I need to know what they are. So we need to be thinking about kind of a holistic type of communication to your employee population to say, hey, everybody, welcome back. For those who haven't been back, here are the things that we're doing now, or here are the things we're going to continue to do, and here's what that process looks like. So they've got the information in their hands to be able to follow the protocols that you're continuing or you're putting in place for the first time. And then, of course, developing a return to work plan, right? So for those who have large populations of office type work where you've had folks who are working remotely, you need to develop an organizational strategy saying, okay, we're no longer required to prohibit folks from being on site here, but do we want people back? When do we want them back? How should we tell them they're coming back? All of those pieces. So we need to develop what that plan and what that process is, but always remember that we need to kind of have a parallel process that runs alongside this to allow for an evaluation of accommodation requests, right? So if you're calling somebody back to the workplace that they haven't been back in a long time and they say, no, I can't, I have XYZ medical condition and I'm still at high risk for COVID or whatever that situation is, you still want to have a process in place to say, okay, how do we evaluate this person's request to remain home? Do we have to, right? Do we have to offer an accommodation, right? Are they meeting certain threshold pieces related to disability or whatever? Or, and even if we're not obligated to, do we want to, right? This based on the employee or your organization, right? What we heard a lot yesterday, even through the governor's press conference, is that there are employers taking all different approaches to this, right? We've got some employers who opened up and everybody came back yesterday, and we've got employers who are doing a much more staggered approach that has a much longer runway. And then we have everything in the middle. And so you just need to develop the organizational strategy that makes sense to you, and just make sure that you're communicating that to your employee base so that they can be compliant with your policies, of course, but also feel informed that they know what to do and know what to expect. Okay.
All right. Thank you, Sandy. We just have a couple of minutes to take some follow-up questions here. I'll answer a few and then maybe I'll give you a few. We can kind of take turns. Does that sound good?
Sure.
Okay. First question, can we ask employees whether or not they're vaccinated on the daily health screening? would that satisfy our compliance requirement to keep records of whether employees are fully vaccinated, right? Just asking them that question. And I think what I'll say to that is, we don't know yet. We don't have enough information yet from MIOSHA about how they intend to enforce that option one, the keeping of the records of whether employees are fully vaccinated, to know for sure what the answer to that question is. MIOSHA is having a webinar today from 2:30 to 3, and they're going to be giving more information, and I suspect they're also going to be publishing some FAQs that are going to shed light on questions like that. I think you have an argument based on the verbiage in the rules itself that you could do that would be an option, ask the question and then keep the record of whether or not they're fully vaccinated without asking for actual confirmation, in other words, seeing their card. But I'm not quite sure whether MIOSHA is going to agree that that passes muster, to be honest. So I would, before assuming that's going to be an option, I would give it a few days and listen to what MIOSHA has to say on that topic. Okay, Sandy, do healthcare organizations still have to do all of those things for patients coming in? I mean, there were a lot of rules, right, about taking temperatures of patients coming into the office and having signs and waiting rooms and all of that. So did those requirements for healthcare, for the healthcare industry go away in these MIOSHA rules?
Right, so they came out of the MIOSHA rules, but there may still be requirements in MDHHS orders, MDHHS orders. You think after this time that would just roll off the tongue a little bit better. Right. That may require the facility to do some of that screening. So I apologize for kind of speaking so broadly, but it will depend, right? If you are, for example, a state-run hospital versus potentially some types of outpatient clinics. So the MDHHS order that is most broadly applicable to the largest group of healthcare facilities is an order from last June that is still in effect. It's the June 3rd, 2020 order that still requires some evaluation of folks for any individual who's entering the facility, right? In terms of asking them about symptoms and all of those pieces. So to the extent that your facility still falls under that order or any of the additional orders, there's a number of orders that apply to residential care facilities as an example, those requirements remain. The only thing that's changed is
they should reach out to their lawyer if they have specific questions on that. It sounds like, right?
You got it.
And the MIOSHA rules do not define what a healthcare setting is. I'm getting questions on that, unfortunately. It just says fully vaccinated persons must continue to wear face coverings when in the healthcare setting where patients may be present. Okay, yeah. So we don't know yet, and maybe MIOSHA is going to shed some light on that as well, what they meant exactly by a healthcare setting. We know the obvious examples, but the ones that are less clear, we're not quite sure about that. Let's see. I'll answer this question. Having had and recovered from COVID in the last 90 days is not the same as being fully vaccinated under the MIOSHA rules. I'm getting a few questions on that. Can I apply or can I also exempt employees who have recovered from COVID from the mask requirements and social distancing requirements? The answer is no, not under these MIOSHA rules. They can be exempted from quarantine requirements if they've had close contact with somebody with COVID, but they are not in the same category as being fully vaccinated with regard to workplace safety requirements. Okay, I think that's probably, we're a little after 9 o'clock here. And I'll tell you what, I'll take one more question because I'm seeing lots on this too. Occupancy in break rooms and conference rooms and other common spaces, okay? There are no specific occupancy requirements in the MIOSHA emergency rules. Just bear in mind that employees who are not fully vaccinated, for those folks, you have to, as best you can, maintain that 6-foot distance between them and other employees. So practically speaking, you're probably going to have employee gatherings, and some of them might be vaccinated and some of them might not, and you may or may not have confirmation of exactly who is and who's not. So that could mean that you should still continue to require that distancing in your meetings, break rooms, conference rooms, et cetera, so that employees who are gathering in there are 6 feet apart. Okay. All right. Well, let's end there. Thank you all for attending. I'm quite sure we're going to be having follow-up webinars as we're continuing to have questions come in and as we continue to have additional guidance from MIOSHA on the new rules. Have a wonderful day, everyone.
Bye.